So thank you for being with us tonight for this session of During Our Forests Continually Giving. Tonight's topic is Canada's first national nature-based prescription program. PaRx, or PaRx, has officially arrived in Saskatchewan. So for our traditional treaty land acknowledgement, we would like to acknowledge that the afforestation areas are situated in the West Swale, Urath Island, Glacial Spilvey, a sacred site in Treaty 6 territory and homeland of the Métis. Those who entered into Treaty 6 are the Mihilwa, Cree, Nakawe, Saulteaux, and the Yankton and Yankatoni Nakota people. May our relationships with the land, standing peoples, forests, and waters teach us to honor and respect the past and invite us to move forward in harmony. May we all come together as friends to find inspiration and guidance from histories, languages, and cultures which broaden our understanding and community collaborations for the present and the future. And thank you today to Dr. Melissa Lem, Director of the PaRx Prescription for the BC PaRx Foundation, which has now arrived in Saskatchewan. Dr. Lem is President-elect for the Canadian Association of Physicians for the Environment and has been a driving and motivating force for promoting the connections between nature and health for over a decade. Dr. Lem was recipient of the 2020 Jewel Innovation Grant, and Dr. Lem is a writer and regularly speaks out on climate action and nature prescriptions on CBC and CTV. Dr. Lem is here today, along with University of Saskatchewan medical students, Brooklyn Rawlyk and Sehjal Bhargava. So I'm going to share my screen now, and I will get Sehjal and Dr. Lem and Brooklyn to unmute themselves as they need to, and they can share their screen now.
Hi, Julia. Thanks for that nice welcome. I want to acknowledge that I'm calling in from the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations here on the west coast of BC in Vancouver. And I wish you had actually given more of an introduction to Brooklyn and Sehjal, because they were really the driving forces behind launching PaRx in Saskatchewan. I honestly feel like I didn't do much of the work there. So anyway, thank you so much for having us. I think the way we're structuring this session is I'm going to start with a bit of a rundown about the health benefits of nature from an evidence-based perspective, and also kind of from a planetary health perspective. And then we'll talk about Brooklyn and Sehjal are going to talk about the amazing work that they did to launch PaRx in Saskatchewan and also where they're at. Is that right? That's what we're going to do. Okay, I'm going to go ahead and share my screen here. All right, so I think a lot of us, during this pandemic, nature and the role of nature and health has really come to the fore. There was a study that was done, a survey that was done over the summer by the Nature Conservancy of Canada, and they actually asked people how important nature was to them during the pandemic. And over 85% of people said that spending time outside, spending time in parks was extremely important for their mental health during the pandemic. And so even though it was difficult to launch PaRx during this time, I think the time was never better, I guess, for people to start understanding the relationships between nature and health and how important it is for us. So I'm extremely excited that you've invited us to speak on during National Forest Week, because that's what we're all about, is getting people out into the great outdoors, out into the forest to connect to nature. So just a bit of background, we launched PaRx in BC for the first time in November 2020, and then we rolled out to Ontario in February and then Saskatchewan in June. And we're continuing our work to roll out across the country. And just a little bit of a preview, next we're going to be launching in Manitoba very soon in October. So keep your eyes out for that. So one of the reasons why, as a physician, I think it's so important to establish and to underline those links between our environments and our health is because really what we do in our healthcare system, what we do as doctors, nurses, in our hospitals and in our clinics, is only responsible for about 25% of our health status. So we like to think that we're really, important in the job we do. It is important, but really it's 75%. Really, we're not responsible for 75% of what makes us well. So really our factors in our environments, our biology, things that have to do with our life, into which nature can play a major part and outdoors can play a major part, really are mostly what's responsible for our health status. And so there's a lot of evidence behind health benefits of nature. I think when I'm speaking with my colleagues about the health benefits of nature, a lot of them really aren't aware of this incredible evidence base. And it was just over 10 years ago that I became aware of it. And I thought at that point, when I was having my own kind of crisis in terms of, why do I feel so stressed when I'm in the city? I had just moved from northern BC working as a full service rural family physician to downtown Toronto, where I was doing some really easy work in student health as outpatients, where there are specialists on every corner and no kind of heart attacks coming into the ER or having to deliver babies in the middle of the night. And I thought, why am I so stressed? And I came to realize that it was actually my lack of nature time. I moved from a place where I was living where there were black bears walking across my driveway and mountains and forests right at my front window, and my commute to work was a 6-minute walk past a misty mountain, and so even though the work was so much more stressful, I found myself so much more, it felt really kind of more relaxed even, and I had so many ways to de-stress, whereas when I moved to the city, even though the work was easier, I found myself much more stressed. And so I thought, I need to start looking into this connection, like this intuitive feeling that I have. It's not real unless it's backed up by science. And so I made it my mission to find the science, and I've been making that my mission ever since, and to communicate those health benefits of nature. So these are just two of the many infographics out there that describe the scientific basis behind the health benefits of nature. And so as you can see on the left-hand side, spending time outdoors has been linked to increased bone density, better immune function, reduced risk of chronic diseases like diabetes, heart disease, and high blood pressure. It reduces depression and anxiety. And then on the right-hand side, you can see in kids, symptoms of ADHD in kids are significantly lower when kids spend time outdoors. You have better work satisfaction, lower pain scores when you're recovering from surgery in hospitals. There's a huge amount of evidence behind the health benefits of nature that's a good 4 decades deep, and the studies are continuing to be run and continuing to be reported. So as someone who's trained in human biology and as a physician, my question is, well, what's the basis behind this? Like, what's the scientific basis of why we feel this way? And so there are 2 major theories behind why nature is so good for our brains. And the first one is called attention restoration theory. And really, the crux of it is that our brains haven't caught up to our environments. So when you think about it, when you spend time in a busy urban environment, it's full of hard edges, often lack of green, lots of busy traffic, people, lights, sights and sounds that constantly require you to direct your attention in different ways to move around those obstacles. Whereas when you spend time in nature, it's what's called a source of soft fascination. So it's interesting, but it doesn't draw your attention in such a directed way. And so what that does is it restores your powers of attention, and it reduces that fatigue and that stress, and just makes your brain feel better. The second theory behind why our brains love nature so much is called stress reduction theory. So essentially, when we spend time in nature, it allows us to recover from stressful circumstances, stressful events better. And again, that sort of speaks to evolution. So nature, to our early ancestors, had everything that we needed to survive. So when you spend time in a biodiverse area, it typically has sources of water, of shelter, of food from animals and plants, of heights that you can climb up high to look out over the landscape, to look for predators and look to where your community is moving next, to feed yourselves. Whereas cities, again, the hard edges, the gray, the brown, doesn't really have that biodiversity that's good for evolution. So essentially, these early nature-loving humans, their brains evolved to love nature, and those nature-loving brains survived longer and passed on those nature-loving genes to future generations like us. So I'm just going to talk about a few of my favorite studies that have to do with the connection between nature and health. And these 2 ones so there are 2 ones that I'm going to highlight first. So this was a study from Toronto that combined high-resolution satellite imagery, individual tree data, and Ontario Health Study data, and self-reports of health perception. And what they found after controlling for a variety of different socioeconomic factors was that 10 more trees per block improved their health perception, similar to an increase in their personal income of about $10,000 per year, or moving to a neighborhood with $10,000 per year higher median income, or being 7 years younger. So we know as healthcare professionals that both income and age have significant impacts on our health status. So I thought it was really neat how this study compared the subjective measure of trees to income and age in terms of health status. So I really like this study, plus it's homegrown, it's a Canadian study. I like this one because it speaks to nature as medication. So this was a small study that was done in Chicago, and what they did was they took 17 kids with ADHD on 3 20-minute walks each through a city park, a downtown area, and a residential area. And a 20-minute walk in the park actually improved their digit span backwards performance to levels in children similar to children without ADHD. So DSB, if you're not familiar with it, basically you recite kind of a series of numbers in a row, and then you ask the subject to repeat them back to you backwards. And so the more numbers you can repeat, the better your memory and attention. And so the kids who walked in the park, as you can see that left-hand bar there, it was significantly higher than the neighborhood and downtown walk. And the authors of the study actually crunched the numbers, and they found that benefit, in fact, rivaled the peak effects of Ritalin, which is a prescription stimulant medication. So no one is saying that a 20-minute walk in the park is going to replace prescription medication, but I think this really speaks to how powerful nature can be as an adjunct for mental health and for focusing kids and adults. So the next thing I'm going to do is just ask you, if you can, enter your number in the chat. So this speaks to our recommendations around nature time that we have in our program. And so I'm wondering if people can answer, what do they think? People report significantly better health and well-being after spending how much time in nature per week? Is it 1 hour, 2 hours, 3 hours, 4 hours, or 5 hours? And you can feel free to just throw that in the chat, and I'll take a look at what people are saying. Oops. See some 3s and some 2s. Some more 2s. And 3s. Okay, you're very close. Actually, you're correct. The people who are answering 2 hours. So the answer is 2 hours. This is based on a study that came out in 2019, and it's a study of almost 20,000 adults in England. And what they found was that their likelihood of reporting good health or high well-being was significantly greater when their nature contact was greater than or equal to 120 minutes per week. And so what they found was that these benefits continued to accrue over time, and they sort of peaked at that 200 to 300 minute per week mark. But kind of that magic threshold for significantly greater health and well-being was that 2 hour mark. So that's why in our program, we recommend that people spend at least 2 hours in nature each week. And so here's another question, our second poll. So where do you think the most efficient drop in cortisol levels happens? Like, what's the most efficient nature pill? Is it between 5 to 10 minutes, 10 to 20, 20 to 30, 30 to 60, or 1 to 2 hours? If people could just, again, enter that in the chat, that would be great. Okay, people are saying 20 to 30 or 10 to 20. Someone's saying 30 to 60. So we have kind of like an equal distribution here, what people think the answer is. And so the answer is actually number 3, 20 to 30 minutes. This was another study that just really coincidentally, or kind of very handily, came out in 2019, right as we were working on launching our program. So this is a study of 36 urban dwellers over 8 weeks, and they asked them to have a nature experience in an outdoor place that brought them a sense of contact with nature for at least 3 times per week and for 10 minutes or more. And they measured their cortisol levels during these periods of time. And what they found was that their cortisol or stress hormone levels dropped about 20% more after a nature experience, and that efficiency of the nature pill was greatest between 20 to 30 between the 20 to 30 minute mark. So meaning like the rate of drop of your stress hormone is fastest between that 20 and 30 minute mark. So we know a lot of us are very busy people. We have a lot on the go. And so if you want the biggest bang for your buck in terms of your nature experience, we do recommend that you try to aim for at least 20 minutes each time. And I think something really neat about this study too was the contact with nature, like their nature experiences were really self-defined. So they asked them, spend time in an outdoor place that is meaningful to you, that makes you feel like you've had a meaningful experience. They didn't say you have to be, on a trail somewhere away from people or on the side of a mountain. It was just when you feel like you had a meaningful experience in nature. So I think that's really neat in that this benefit was seen when people kind of self-defined what nature meant to them. And so I'm also president-elect of the Canadian Association of Missions for the Environment, and our mission is to better human health by protecting the planet. And so this is another reason why nature prescriptions are so important to me. And kind of based on the work I've done with them, I've really learned that health is a really effective message for motivating people to make changes in their lifestyles. And that's why, in part, the BC PaRx Foundation has really focused on the health benefits and trying to motivate people to get outside into our beautiful parks here in BC and across Canada. So we can take some of our lessons from health as an effective message from the climate change research. And this was a neat study that questioned over 300 American parents about their greatest concerns regarding global environmental issues. And 3 different forms of environmental concern arose: biospheric concern, or concern for nature; social altruistic concern, or concern for other people like their families; or egoistic concern, like concern for themselves. And what they found was that the people who didn't already love nature, they didn't really care about the images and messaging around polar bears and coral reefs and forests. What they found was that testing messages about climate change that focused on their personal and family health impacts were much more motivating to them to change behavior. So if we want to convert the largest amount of people to becoming kind of conservation and nature advocates, it's really good to focus, one really effective way could be to focus on health, to convert the unconverted. And then again, as someone who does a lot of work around climate change and health, connecting to nature is also good for the planet. So healthcare is a major contributor to global carbon dioxide emissions. If global healthcare were a country, it would actually be the 5th highest emitter in the world. So anything that can improve patient health status will also reduce our carbon emissions and healthcare system burdens. So as you can see from what I've said, connecting to nature and increasing people's nature time is a really powerful way to improve their health. So that's also a way to reduce our carbon emissions. Also, making it easier for people to connect to nature, whether it's in rural areas or in urban areas, is also good for our cities, because if we increase green space in our cities, we'll reduce things like the urban heat island effect. We'll reduce the chances of flooding if we make sure that our wetlands near our cities are healthy. And if we make sure that we don't have a lot of hard concrete surfaces that don't absorb water when it falls from the sky. So again, increasing nature in our cities can make us healthier and our cities healthier. Also, there's research that shows that children who have more nature experiences are more likely to become adult environmentalists, and adults who are more connected to nature are more likely to protect it. And the really interesting thing is this goes beyond just conservation, which you'd think would be, which you think would make sense. In fact, those pro-environmental behaviors actually extend to things like recycling, like energy conservation, like political advocacy. It's not just conservation. So I like to think every time I write a nature prescription, every time one of my colleagues writes one, we're doing our part for the planet by creating a body of people who really want to engage in those pro-environmental behaviors over and above conservation. And finally, Inger Andersen, the executive director of the UN Environment Program, has said that nature is one of the most effective ways of combating climate change and should be part of every country's climate strategy. So I think something that often gets missed in the climate literature is that if we fully engage in nature-based solutions for climate change, that could get us over 1/3 of the way towards our Paris Agreement targets. Currently, only about 3% to 5% of global climate investments are in nature-based solutions for climate change. So I think as health professionals, by elevating that nature and health message, we can increase support for these nature-based solutions for climate change and help to close that gap. Just a quick little bit about our program. If you want to check out our website, it's at prescriptions.ca, and I think, a really kind of practical and concise website. We tried to keep nice and concise for prescribers and patients who want to find out about a program quickly. And under the prescribers tab, you'll find for different fact sheets. One of the ones you can secure is on the right-hand side, that are broken down by different health conditions and systems that talk about the specific benefits of nature for certain conditions. And I think it's a good way to kind of remind prescribers about all the different conditions, not just mental health, which we often think about, but also lots of chronic diseases that benefit from spending time in nature. And then when you register for a program, if you're a licensed healthcare professional, we'll send you a customized nature prescription file, which you can see on the left, that you can load into your electronic medical record and start prescribing nature and joining us in our big initiative. And that's my last slide. And I think I will hand it over to Brooklyn and Sehjal.
Thank you so much, Dr. Lem. As always, I'm just going to share this presentation. All right, can everybody see that?
Yes, it looks good.
Perfect. Well, my name is Brooklyn, and I'm one of the medical students who helped try to bring, we brought it to Saskatchewan. We're proud to say that because it's such a beautiful province and there's just so much to offer. And I know Sehjal here is joining me and she's just having a second, but we're both just so thankful to be here to present today.
Hi, everyone. Thank you, Dr. Lem, for the...
Sehjal, are you good?
Yes, I'm good. Can you hear me okay? Okay, perfect. Thanks, Dr. Lem, for the introductory layout of prescription nature. As mentioned, Brooklyn and I are medical students in Saskatchewan here, and we're so excited to have been able to partner with BC PaRx Foundation and Dr. Lem to get this launched in Saskatchewan. So we'll be talking through kind of the process about how we did this and the reasoning why, as well as where we're at in Saskatchewan with this initiative. Thanks, Brooklyn. So Brooklyn and I are both members of the Canadian Association of Physicians for the Environment, the Saskatchewan Regional Chapter, as well as the national organization as a whole. This organization is incredible. It's a interdisciplinary, multifactorial organization that works on political and environmental advocacy from a health perspective. And I think that that's such a driving force for a lot of physicians. As you know, I think one of my favorite quotes is, "We're only as healthy as our environment." So environmental health and personal health are so closely interlinked, as Dr. Lem highlighted in her presentation above. So when we were looking at launching this initiative in Saskatchewan, we wanted a group of individuals that would be just as invested as we were, and we found a home for that within Cape Saskatchewan. So this is a team of social workers, nurses, doctors, medical students that have taken on this role to kind of get this project and initiative launched within Saskatchewan. And we're only into I think we launched in January, so we're into September, which is our 9th month. And I'm so proud of the work that this team has already done. So prescription nature is definitely one of the highlights.
So to give you a little bit of an idea of how formalized nature prescriptions came to Saskatchewan, it actually started with a nature photo contest that BC PaRx Foundations put on through Twitter. And I joined into this contest, and through that, I followed Dr. Melissa Lem and started to hear about something called nature prescription. And kind of following along, hearing that this was something that was implemented in BC and Ontario, we thought, well, why can't Saskatchewan be next and be that first prairie province? And as Sehjal mentioned, we're both medical students and have a history as competitive runners. So we kind of felt that we've had that firsthand connection and felt those benefits of just time spent out in nature. So as patients ourselves experiencing that benefit, we thought, how incredible would that be for other patients to kind of learn about that benefit as well? And as Dr. Lem shared some of that incredible evidence, something that really stood out to us was our connection with CAPE and really that impact not only on our own health, but that preservation of the environment. And something else that we thought was so incredible is when we talk in medicine about something called social prescribing. And this kind of comes from like a lifestyle intervention of making sure that you're eating well, so good diet and exercise and sleep. However, we also think that nature should be that fourth pillar. And if anything, this initiative was quite interesting because when you think about nature, there sometimes can actually be less barriers to getting those benefits. As Dr. Lim mentioned, as long as you have that experiencing, or as long as you have that meaningful connection with nature, you don't necessarily need to go drive 40 minutes to a park or need to get that perfect place. As long as you can spend some time outside, that is enough to experiencing that. And here we also have a few of the blurbs that were taken from the Nature Prescription website and really just highlight kind of that connection with climate change and how really we do need to protect our spaces. And we're really only going to be able to do that by getting people motivated and feeling really connected with nature.
I think one of the other things that was interesting in launching this initiative was being a third-year medical student and actually being able to speak with patients for the first time on a really like day-to-day basis. And finding that people within the pandemic especially were finding that the connection with nature was already being established so naturally in their lives. We thought that, especially with the summer months coming, this initiative launched in July in Saskatchewan, and still being in a pandemic, it was just such a timely intervention to push, and we found a lot of local support. So leading to this next slide, gaining local support was one of the, Dr. Lem was like, you guys need to make a team. We need to come up with like organizations that will support you. And it was actually really, really incredible to kind of figure out how many people were actually interested in supporting this type of program. So we initially began with a presentation of a motion at the Saskatchewan Medical Association Regional Assembly, saying that physicians and the SMA will support this type of initiative if it were launched. And at that regional assembly, which is a collection of physicians from all across Saskatchewan, that motion passed with an 85% majority. So 85% of physicians were already in step with this type of program and were willing to support it, and agreed that the SMA as the Provincial Medical Association should also get behind this. So we had the support of the SMA as well as their marketing and email people and people that were able to kind of bring this all together and get it out into the world. We also found friends and connections and endorsers within the SANP, which is the Saskatchewan Association of Nurse Practitioners, the Saskatchewan College of Family Physicians, our public health people at the Saskatchewan Public Health Association, as well as our team, the BC PaRx Foundation and CAPE. And so this was actually incredible. All of these people agreed to endorse this program as we were launching it, which just lent to the credibility and the importance, as well as the all-encompassing nature, no pun intended, the all-encompassing nature of this type of program. When we talk about health, all these people found that this would be a valuable program to implement. So we were able to kind of spread the word and use these organizational bodies as endorsers for the movement. And through that, we were able to kind of launch successfully in Saskatchewan.
To give a little bit of idea how we gained that public momentum, we were fortunate enough to have some media coverage through CBC. We did a radio interview with Shauna Powers, and we had a TV interview and some different articles that the University of Saskatchewan had published, just trying to bring this to action and hopefully show the general public. And one of the questions that kind of came up in some of these interviews that we wanted to share was kind of what response are you getting from healthcare professionals and providers and like the general public? Like, what is that response looking like? And we'll dive in a little bit to the healthcare professional side of things, but I just wanted to share personally, it was really cute. My mom the other day, she was just really excited, and she said, you know what, today I'm going out and I'm going to go fill my nature prescription. She said, I'm going out for 20 minutes. I'm going to just get out there, leave my stuff, and really do that for myself. And I think this is a really great example of just how empowering this can be for individuals. It's something that not only can be enjoyable, but extremely beneficial for your health. So I thought that was a little nice tie-in point to see just how people can get excited about this kind of initiative.
So as media coverage picked up and as our endorsers were, happily spreading the message, we are kind of able to continue to spread the message. So this is an example of one of the graphic design posters that we created with photos from Saskatchewan by yours truly, Brooklyn and I. So we created this poster with the following information as a infographic for prescribers. So we sent this to doctors ahead of our launch, being like, this is something that's up and coming. Look for the website, like you're invited to go register as a prescriber, as well as to start bringing this up with your patients, because this is now something that once we launched in Saskatchewan, we could start to administer locally. So like Brooklyn mentioned before, we did a lot of media interviews, which was an interesting and amazing experience for both of us. We got to talk about nature and climate change and medicine, like our three favorite loves. So incredible opportunities there. We wrote an article. We shared these, the next steps in this is that we're going to be sharing posters widely that are meant both for physicians as well as patients. Patients are encouraged to ask their healthcare professionals. Again, this isn't something that has to be prescribed by a physician necessarily. It can be by a pharmacist, like physiotherapist. Even some of my friends are in physiotherapy and they were interested in being prescribers. And I was like, you definitely can, just go to the website. So your physiotherapist even. And, I think one of the best things about health and healthcare recently is that I believe it should be a patient-centered motion. So if a patient brings this up as something they'd like to explore, I think the prescriber should be, okay, yeah, I'll go onto the website and read about it. And, the patient can even be like, here's the website if you wanted to be that, a bit of an advocate for yourself and your own health, which is always encouraged. So we'll be beginning to spread these materials through medical offices as well as different pharmacies, and create some patient-centered handouts for patient education, because I think patients are their greatest advocate, truly. So this is our plan for rollout in Saskatchewan for the next few months.
Yes, we're very excited. Lots in the works. And here we wanted to show a few quotes from different healthcare professionals and patients on kind of what their idea of this program is. And it's just been a lot of, for instance, showing about how for a healthcare provider being able to kind of have a more holistic connection with their patients in talking about their health. And when we were first bringing this out into Saskatchewan, we found it to be quite interesting just how many providers had already been informally prescribing nature for years. So a lot of providers are getting really excited because through the Nature prescription website, which we all have access to, there is access to all the incredible evidence there that Dr. Lem spoke about. So it's really neat to be able to have a program that's endorsing time spent in nature, and that even as a patient or as a healthcare provider, you can access that information and really see that science that supports why we want to drive something like this within our province.
So since launching in early July, we have 56 current prescribers registered amongst healthcare professionals in Saskatchewan. And and counting, because we're still, we're going to push for this come the fall and the winter, because, Saskatchewan winters are awful, but as Dr. Lem mentioned earlier, this prescription can extend beyond spending time in nature. It can even be looking outside of the window or looking at pictures of nature. So if that's something that's more accessible to you in the winter months, that still counts as in banking your nature prescription for that day. So for prescribers, the website is open to you in Saskatchewan. You are able to go and sign up as a prescriber and get that notepad, get that prescription pad, and begin to write physical prescriptions for nature for your patients. And for patients, we encourage you to bring this up with any healthcare provider that you trust and want to have this conversation with. So yeah, definitely something that we're hoping to get the word out, but 56 and counting in Saskatchewan currently. So some of our future directions, as we touched on a bit earlier, was that we would love more prescribers. So Brooklyn and I are talking about this at every opportunity we get with our colleagues, with the doctors I'm working with in my fourth year of medical school. I get to work with a ton of public health physicians and pediatricians and family physicians, and I'm bringing this up at every turn I get because I think it's incredible, as well as increasing our advertising capacity. Increase patient awareness through the handouts, as we discussed. We're looking into different collaborations with other organizations such as hospital foundations, as well as collaborations with provincial parks, potentially like we're seeing in BC a little bit more. So maybe like a discounted provincial park pass or something would be something that we would love to figure out a way to get this, in conjunction with prescription nature, as that was often a question that was actually asked. We got that idea from people that were interested in the program. So we'll see what we can do in terms of actually extending our access to different nature avenues. But as Brooklyn mentioned earlier, this is such a widely available and accessible thing, but maybe access to provincial parks and national parks would be an incredible next step.
And lastly, another direction I want to talk about, especially as medical students, is really engaging those future physicians. Actually, back during Earth Week, myself, along with some fellow medical students from other parts of Canada and some interprofessional healthcare students, we put together a webinar, and we had different healthcare students from across Canada come together and have a really rich conversation about what is nature prescription and what are some different barriers that might come up for prescribing in like a rural community or a large urban center or a smaller urban center. And something that I wanted to bring up tonight that was discussed is basically that what could be hindering healthcare professionals from actually sharing this prescription. And really it might come from a lack of familiarity with nature, or even just the education behind those health benefits of nature time. So the best way that we can combat that is hopefully bringing this early on into medical education and to help those future physicians so that when they first enter practice, this just can become another part of their skill set and their toolbox, and it'll just be a little bit more natural and they can feel more confident speaking to it. And so I know through University of Saskatchewan, we're hoping to host a lunch talk coming up in the next little while and kind of have an interactive discussion with more medical students and hopefully kind of continue with that engagement. So thank you so much for taking the time out of your night to be with us. And we hope that you all had a chance to enjoy the beautiful weather we had today, especially if you're calling in from Saskatoon. We had a gorgeous day. So again, thank you. And we really hope that you're able to take something out of this presentation.
Thank you so much, everyone. I really appreciated the talk that Dr. Melissa Lem started with, but I'm amazed at how much you're doing, Brooklyn and Sehjal, as well. You're really helping to launch it in Saskatchewan, and I'm sorry I didn't get your introduction better, because it's just amazing all the work you've been putting into this project, and it's phenomenal. Does anybody have any questions for any of our speakers? You can either unmute yourself or put it into the chat box if you have any further questions that you want to bring forward.
I just wanted to comment, thank you so much, Brooklyn and Sehjal. Every time I hear you speak, I feel like I learned something new about what you're doing in Saskatchewan, which is amazing. Thank you so much. I just wanted to let people know, I guess, to stay tuned for an announcement. Actually, it might not happen so soon, but we are actually creating partnerships with different parks organizations on a national and provincial level to provide free park passes or discounted park passes to prescribers for their patients. So anyway, just so you know, it's coming down the pipes.
Very awesome. That's very exciting news. I'm glad to hear that. We do have a comment in the chat saying that they really appreciated your excellent presentation, and they hope that you have a good uptake everywhere that you're going through in Canada. So that's awesome.
Yeah, just as an update, we have, I think it's almost 900 prescribers now across Canada, and the majority are physicians. And so, Sehjal and Brooklyn, you probably know, it can be hard to get physicians to change practice or to do anything, right? If it's a very new concept. So I think the fact that we have, I think right now there are 80 to 90,000 practicing physicians in Canada. So it's almost like 1% of physicians, which I think is pretty incredible. And we're just continuing to sign up prescribers. So thank you. But the work that you're doing in Saskatchewan is a huge part of that too. And spreading the word to other medical students as well, because really you'll be future prescribers. So it's fantastic.
Julie, it's Verity Moore, right, calling or on the line from Nature Conservancy of Canada.
Hi there, Verity. How are you doing tonight?
How are you? Good, thanks. I just wanted to mention we're really thrilled to learn about this partnership and the fact that it's launched in Saskatchewan. Nature Conservancy of Canada is a national organization that's in Saskatchewan as well. We're across the country, and our mission is we're a private land trust, and we're our big focus is on setting aside lands that have not been developed, priority areas for nature. And so one of the things we recently embarked on is something called nature destinations, which allows the public to go onto our properties. And 4 of those properties in Saskatchewan have trails mowed on them and interpretive signage. So if you're looking, we have wonderful places to hike in Saskatoon, but if you're looking to get outside of the city a little bit, there's a new one at Asquith, which is on our website and is a beautiful area to go out and hike, especially right now with the fall colors and lots of action out there. So lots of wildlife and so on. So I just wanted to mention that, and looking forward to working much more closely with Brooklyn and your team in the future. Good to see you, Julie.
Good to hear from you, Verity, and I'm glad you mentioned that. It's very exciting, the work that the National Conservancy of Canada is doing, and thank you for bringing it forward. You'll have a great team.
Hi, I'm very impressed with this, and for you, Sehjal and Brooklyn, I mean, what an adjunct to your academic education to be involved in this advocacy and media and all the aspects that are involved in what you've done. Now, is there any opportunity during your, I think you mentioned it, but I didn't quite get, during your training to present to other students in medicine, or how are you promoting it within the student body? And secondly, have you ever visited the afforestation areas as a place for people to go?
Thank you, Robert, for your comments. I'll let Brooklyn or Sehjal answer that.
Love the web. Still, it's always hard to know who's going to start talking, but I can take it off first. So with nature prescription still being quite new in Saskatchewan and us launching over the summer, now that we're back in classes, that is where that next piece of advocacy is coming. Within our College of Medicine, we actually have an interest group known as Planetary Health Student Group. And Sehjal was a past president, and now I'm taking on the role, big shoes to fill. And so we're hoping, kind of on a more casual scale, to host an event where different students are welcome to come and kind of learn more. And the vision right now is to actually prescribe everyone that nature time and hopefully go out for 20 minutes and then come back and be able to discuss and kind of do a little bit of a role playing of how you might bring it up with a patient. But definitely in the future, hoping to speak with the college and see if they might see a role in this within actual medical education, because that would be the best long-term goal, to have that longevity, and hopefully that class after class can at least get a little bit of experience and exposure to it. And personally, I have never explored the afforestation areas, and I'm really glad that we were invited to come speak and to meet all of you and all the wonderful work that you are doing, because it's always incredible to be connected with the community and see what is going on and how we can get involved.
Thanks, Brooklyn. I'm just going to add that, Brooklyn is doing some incredible work with medical education, as well as educating our peers in her current leadership role through lunch talks, as well as I think your newest project is a lunch talk that includes actually going out and having a 20-minute bout in nature and experiencing it, coming back and reflecting on how you feel after it. So actually getting medical students to experience that themselves and getting that experience, I think will just help drive it home even more. So Brooklyn, you're doing incredible work. And yeah, in terms of the afforestation areas, I wasn't entirely aware of the work that this organization does, but now looking into it more, I'm all the more impressed. And I think it's something that we can definitely even tie into our education towards medical students as well as professionals about the areas available in Saskatoon and localing areas to participate in this kind of initiative.
Thank you, Brooklyn and Sehjal. I liked your 2 different viewpoints on that answer. It was awesome. Does anybody else have a comment to either speak up on or put in the chat? I have a question. Something I learned about is the Dual Innovative Grant that PaRx received in 2020, and it might go towards building an app and help with the web application. Do you want to say anything more about the progress being done on that? I don't know who wants to talk to that.
Sure, yeah, I will because it's a BC PaRx Foundation initiative. So one thing that we really would like to do is to start to gather data around what happens when we prescribe nature, how much time people are spending in nature, what the benefits are to mental health. And also we want something more than a physician or a nurse recommending to them that they spend time in nature, because there is evidence showing that just that kind of patient healthcare worker relationship is motivating, but really, you know, usually people need a little bit more than just like some words or something written down on a piece of paper. And so our app is in development right now. We have contracted a local company in Vancouver to help us take it over the finish line. That basically is going to be something that helps track and incentivize nature time. There will be sort of prompts, you know, when maybe you're not getting your nature time, there will be perhaps rewards involved when you do get your nature time, and it will sort of have that 2 hours, at least 2 hours per week and at least 20 minutes each time targets built in, and you also have the opportunity to set your own targets. But yeah, it's in the works. And we had a really neat meeting actually with Nature Quant. There was a neat article that came out in Outside Magazine recently, and they're a group in the US that's looking to kind of automate tracking of nature time, and again, kind of give you these prompts when you've hit your nature dose for the week. And the neat thing is, was something that maybe good for some people and less good for other people, is that it's automated. So you just have it on, you'll have your app on, and wherever you go, it'll calculate your nature time. Some people might not like the idea, you know, of something like an app tracking where they are and when they're in green space. So anyway, so we're in talks with them to see how we might be able to integrate their technology into our app and launch something that has options for people that might make it easier for some, but also less trackable for others. But yeah, it's in the works. Hopefully by the end of the year, we'll be launched.
That's very exciting. Thank you very much for that clarification. And that brings me to my next question. I know you're really, really busy having it launched in BC and now Ontario and Saskatchewan and then next Manitoba. Have you had any uptake internationally on your program as well?
Do you know what's funny is we have had people from South America, Italy, Australia, you know, France trying to sign up to prescribe nature through our program. And part of me wonders, like, why don't we just let them do it, you know? But I feel like we want to launch across Canada first. And so right now, for example, like we haven't launched in Quebec yet. And I don't know if it feels right to let someone in Italy prescribe nature when someone in Quebec can't yet. So I think that's a longer term goal. But yeah, we've been contacted by people from across the world actually who want to sign up to prescribe nature through our program. And we do actually have some partnerships right now. There's a group in the UK who's reached out, and another group in Australia who's reached out to collaborate on some major multi-million-dollar grant applications to try to fund research around nature prescribing specifically and how effective it is and what makes it effective. So yeah, there's a lot in the works internationally too.
That is so exciting. That is fabulous. I'm glad to hear that. That's wonderful, especially this day of age with climate action. Like you say, the more you have people getting out in nature, the more they're going to be wanting to do nature-based solutions to climate change and everything to get international support. That's fantastic.
I wanted to ask about one of the points in the graphic, and I think it's on your prescription summary thing there about, it says 10 more trees per block. I mean, if you have 10 trees already, but 10 more, if you have 0 trees, 10, I mean, it doesn't seem quite to calculate.
That's a good question. I think you'd have to ask the study authors, you know, for more details about that. But I think, yeah, I'm not sure what the baseline was, and you know, and what the most trees on the block was, but But let me see if I can find the study link and put it in the chat for you, so you can take a look. Let's see. Neighborhood green space and health in a large urban center. Just give me a moment and I'll find it for you.
Thank you.
Someone else can ask a question in the meantime.
Well, I guess if you live in the grasslands or in the tundra, it's a tree bias. I love trees, but
Well, this specifically looked at Toronto, right? So there's no tundra
Okay.
or
Okay.
like, you know, grasslands
okay.
in Toronto. But here's the article. I just I found it.
Thank you.
Take a more in-depth look at that piece. But I think that really speaks to, Robert, your point about lack of nature in some urban areas. Like we typically find that low-income areas have far less nature in them, and so they're subject to more issues like the urban heat island effect, like, you know, worse mental health, worse physical health status. So I think that's definitely something that we've tried to speak to, like in media interviews and in writing, to kind of try to close that gap in health between treed green areas in higher income neighborhoods and less green areas in lower income neighborhoods. Like there is research showing that neighborhoods in urban areas that have more green space, actually the health disparities between lower income and higher income are much narrower. So I think that it is a huge issue for equity, and something I think that a lot of urban planners and city officials are waking up to as well. Where you got those awesome testimonials from, you know, from people about the PaRx program. Like I've gotten a few from colleagues just casually, but yeah, I want to hear more about who you've talked to about this and how you've gotten your feedback.
Definitely. So it was definitely through a lot of the CAPE meetings was definitely one of the areas that people were talking about their feelings and emotions towards this. I actually had some colleagues approach me as we began to launch in hospitals that came up and like, this is amazing. Like I've been doing this informally, but seeing the evidence behind it has been incredible. As well as one of my mom's patients actually told her, my mom's a family doctor in Saskatoon. One of my mom's family doctor patients told her, you know, kind of their interpretation of the prescription. As well as we shared it in a group on Facebook, women physicians in Saskatchewan, and a few of them commented on our post originally with some comments or reached out to us and just, you know, kind of shared their thoughts. So a lot of them were informal conversations or just exchanges over social media.
Great.
That's
Thank
nice.
you so much for your amazing advocacy. Anyway, like I said, every time I hear an update from you, I'm blown away by how much you're doing.
Yes, for just being launched in July, it's really made a lot of airwaves and media reports and social media. It's fantastic. And it's a good program. So I wish you all the best with it.
Thanks so much. And I just want to say a huge thanks to Dr. Lev and her team at BC PaRx, because this would not have been possible without their support and guidance. So Brooklyn and I were able to do what we did because of your support and your help. And I'm so excited to see how it launches in Manitoba and across the rest of Canada.
Thanks so much. It's like a mutual admiration society. It's great.
And also to the Afforestation, your guys' organization and work is incredible too. So thank you so much for having us here tonight.
Oh, you're very welcome. It's been, I was so excited when you guys said that you would come, and because I realized how healthy I feel after I've been out in nature. So just spreading the word to everybody is very exciting.
I'm just thinking, you know, another outreach group might be, you know, like for instance, I have a friend who's a professor in School of Architecture and Urban Planning at the University of Manitoba, and there's a School of Environmental Sustainability here. I mean, a lot of people are involved in planning. You know, they would be an interesting group to know about this kind of thing as well, from their end, right?
Yeah, and it's totally true. The more links that we can make between groups of people who can move this nature and health agenda forward, the better. Like, for example, in Vancouver, where I live, I'm often in touch with the City of Vancouver staff about their climate emergency action plan. And one of the points on their plan is to increase green space, increase tree cover within Vancouver. So if Brooklyn and Sehjal or anyone else you work with, if you could get in touch with the people who are helping to make those decisions. The health voice is so powerful. I'm not just speaking because I'm biased, like the research, kind of backs that up, that you could really make a difference in local policy, for example. So yeah, that's some of the most rewarding work that I've done has been on the municipal level, for sure.
After the webinar here, Dr. Lem and Brooklyn and Sehjal, I will hook you up with Robert so that you can connect with the professor he knows out at the University of Manitoba and get you that networking going.
That would be great. Thank you.
So I think our questions are just about coming to an end for tonight. So I'm just going to say again, thank you to Dr. Lem, Brooklyn, and Bhargava for this wonderful, Sehjal, sorry about that, for this wonderful presentation for nature-based prescriptions. Your enthusiasm is totally contagious, and it was truly a memorable evening. The slides you showed gave us a close look at the program, and we thank you for your invaluable expertise and the amount of advocacy work you've done for the public to know about it. It will enrich the lives of ever so many people, and it is a very worthwhile initiative to benefit the health and the wellness of our communities, which is like a very important part, especially during COVID. Everybody's supposed to be social isolating, and what better way to do it than being outside safely in nature? So that's wonderful. So you're right, it was the perfect time to be doing this program. So the slide I have up now is just a little bit about National Forest Week, and we're coming to the end of National Forest Week. There is one more event tomorrow afternoon where we're actually having a walkout at the Afforestation Areas at 2 o'clock. If you want to have like a heritage tour or get to know our naturalists to know about the plants and animals out there. And then on Sunday evening at 7 o'clock, there'll be an introduction to biophilia. And so that will be the ending one. And then we're going to also have in November 6th, a very exciting heritage documentary at 1 o'clock Central Standard Time, which is UTC -6. And this will be the 50th anniversary of when Richard St. Barbe Baker received his honorary doctorate of laws from the university. And Richard St. Barbe Baker himself actually wrote a book about his healing time in trees. And he had an epiphany when he was a very young person, and this revelation to him bonded him with trees very much, and he actually could feel the energy from trees healing him if he laid his hands on the trees. That's how intense his experience was. So that's really awesome. And we'll be having people internationally speaking in our heritage film that actually knew Richard St. Barbe Baker. So it's a very good testament to what he did globally for planting billions and billions of trees worldwide. Many people don't know about the afforestation areas. They're located on the very southwest edge of the city, inside the city limits. Richard St. Barbe Baker is 326 acres in size, so lots and lots of room for social distancing, and there's trails. It's actually easier to walk out there in the winter than any other time of the year because the Fat Bike group actually grooms the trails. So there's no reason to not even get your nature-based prescription in the winter months. And during a fresh snow or hoarfrost or rime ice, the afforestation areas are very beautiful. I really like the work that Nature Conservancy of Canada is doing because they're promoting and supporting our native-based environment, and where our group realizes the importance of our native environments in Saskatchewan. We also realize that we have to drive past Prince Albert or North Battleford to get into a mixed woodlands. And here we have a man-made forest in the prairies right inside the city of Saskatoon limits. So if during COVID you can't take holidays and you can't get out to the forest up north to camp or to enjoy, you can enjoy the forest right here in Saskatoon. And George Genereux Park is 148 acres. And so they're both great places and very local to get out and have your 20-minute prescription walk in nature. So that's all I have to say. And Thank you. Oh, cool. Someone's written in the comments that someone can't wait to take a run and explore out there. That's Sehjal. Thank you so much. That would be exciting. Yeah. Very nice.
Well, thank you so much, Julia, and everyone for joining us. It was great to talk with to nature lovers. I always love speaking with nature lovers.
Cool. Right. Oh. And then Rob just put his email in the chat, but I'll make sure you connect also through the email afterwards. So yes, that's awesome. So thank you very much again to Sehjal and Brooklyn and Dr. Lem. That was a very exciting session. I really enjoyed it. And thank you everybody for coming out. That was a good turnout, and I'm glad you were here. And then you can help share. You can help share all the networking these people are doing in Saskatchewan.
Thank you so much. Have a great rest of your evening, everyone.
All right. Thank
Bye.
you.